If you struggle with chronic back pain for long enough, chances are you will run into the name of John Sarno. Dr. John Sarno was a somewhat controversial figure in the medical world. His ideas were, I think they were revolutionary, honestly, but they also had a few flaws, and we're going to talk about all of that in this video. He was an interesting figure for his time. I think he passed away a few years ago, and I think his ideas, while really helpful and useful, I think they didn't really get a lot of traction and a lot of the attention and merit they deserve. And this video is, it's not going to be entirely a tribute to Dr. Sarno. I think I should definitely do a video like that. But we are going to discuss about the things that Dr. Sarno was completely right about, and they deserve a lot more attention, and he deserves a lot of credit for this. I think his ideas were, a lot of them were really revolutionary and really helpful for people. But I think he also kind of missed a few things. At least that's my humble personal opinion, as someone who struggled with chronic back pain for 10 years, and I kind of learned a thing or two on my own as well. So Sarno was a doctor who dealt with a lot of patients who complained about chronic back pain. First of all, he states that a lot of people have degenerative disc diseases, but they have no back pain, which clearly means that that's not a one-to-one correlation here. There are, if you have, let's say, a bulging disc or a herniated disc, it doesn't necessarily mean you have to have back pain. And a lot of people who maybe sit or work in an office job, they are going to have some disc problems or degenerations, but they're not going to feel back pain, which means the disc is not the issue. It's not the primary root cause for chronic back pain, probably in most cases. Dr. Sarno was really strong on the mind-body connection, and in his approach, chronic back pain is usually due to unresolved emotional, psychological issues, stuff of that nature. He helped a lot of people completely dissolve chronic back pain just by helping them become aware of this connection, and just by maybe uncovering a few issues, main issues that may have been bothering them. Issues like rage or anger were typical for a lot of his patients, but also maybe other negative emotions, sadness, guilt, fear, anything that's really like a major negative emotion. And once patients became aware of their problems, and once they kind of like accepted this idea that back pain may not be a purely physical problem, or it's not a physical problem at all, in his words, they healed actually quite instantly in a lot of cases. He also claims that a lot of his patients completely healed their chronic back pain, even when they've struggled with it for years. Maybe they've had multiple diagnoses, maybe they've had even several surgeries, or other treatment options have never worked for them. But once they read his books or became aware of these connections, this like kind of mind-body connection, they healed instantly and permanently. And at the time, I think this was maybe his approach was really starting to kind of gain some attention, maybe in the 80s. And at the time, this was a completely, almost like insane idea. The entire medical community, I think, was kind of like up in arms. Everybody was convinced that, you kind of have to like do surgeries or take injections, and there is not really like a solution to this problem. And this was like a really revolutionary idea at the time, and for that reason he ran into a lot of obstacles. His ideas were primarily rejected for the longest time, and I think they never really gained the mainstream traction. If you go through the literature, through like the recommended best practices about chronic back pain, even today, you're mostly gonna see the same things that were recommended over the past 20, 30, maybe 50 years ago. You take some painkillers, you do some physical therapy, maybe you do some surgery if that doesn't help, and that's pretty much it. Like those are your options. I'm starting to see a little bit of like a small kernel of this idea growing, that maybe some therapy, some cognitive behavioral therapy, may be a good avenue to approach when it comes to addressing chronic back pain. And honestly, that warms my heart. I think we're going to start to see this approach gain a lot more traction. But still, the main like accepted consensus in the medical community when it comes to chronic back pain is that You just take your painkillers, you go through therapy, you do a little bit of like rehab, and that's all you have to do. And you're probably not gonna heal. You're probably gonna struggle with this problem for the rest of your life, and that's it. Like that's your verdict, and like go and deal with it. And personally, I discovered Sarno pretty early on my pain journey. Maybe it was even like in the first few years, but during that time, I was really reluctant to accept these ideas. I was a really kind of like a rational, logical person. Didn't make any sense to me. Like I couldn't accept the idea that maybe an emotional or psychological problem is causing my back pain. And I paid the price for that. For I struggled with chronic back pain for 10 years, which was probably at least 9 years longer than I should have struggled with it. And then after all of those years, I kind of stumbled onto Sarno's books and ideas again. This time I was a lot more desperate, so I was a lot more open-minded. I decided to give them a proper shot, and what do you know? They work really well. They completely have a lot of merit. There is a lot of use in these ideas, which is why I think a lot of people will start actually utilizing this approach more and more, especially as Western medicine and big pharma and all of these like industries, they kind of keep disappointing people as time goes by. Now, Sarno was big on the idea that the problem is only psychological and only emotional. And this is probably maybe the one point where I kind of might disagree a little bit. Because for me, like Sarno's approach was instrumental, it was foundational, it really helped me completely resolve my back pain. But I also think there is something to be said about the other problem, part of the problem. For some people, like definitely only pursuing the psychological and emotional parts will be very beneficial. They will probably heal completely just by doing that. But for a lot of us, I think this is going to be somewhat of a mixed problem. We're going to kind of have to address not just the psychological and emotional parts, but also the physical ones. It's really a good idea to strengthen your body, I believe, and to strengthen the muscles around your back, especially, and in your core. And I really think nutrition also plays a huge part, especially since chronic conditions are often related to inflammation, and you can really control your inflammation levels through nutrition very effectively. But what I do know pretty much for 100% certainty is that if you only pursue the physical path and you try to heal maybe through recommended Western medicine approaches or just by maybe strengthening your body, you're gonna run into a dead end probably. Like, I hope whatever you're pursuing is helpful to you. I hope you heal quickly and easily, but you may discover that you struggle with back pain for a few months or a few years, in which case I think it's usually a sign that you're probably not addressing this other part of the problem, the whole like psychological and emotional part, which I really have to thank Dr. Sarno for this, because I think his approach was actually what kind of was a big revelation for me, and what finally helped me completely resolve back pain for good. I strongly recommend people read his books, especially the Mind-Body Prescription and the Healing Back Pain and the Divided Mind. I think those three are really excellent books. If you struggle with back pain and maybe other joint pain even, I strongly recommend reading those books. But once again, I think maybe if I might humbly add, like maybe addressing the physical component of the problem can be beneficial for a lot of people, and that's my approach. That's why I actually recommend people do. I actually recommend you pursue both of the avenues of healing, and you're gonna see which one works for you better. If you want to learn how to heal a chronic back pain completely, as I did, and this is also going to involve Sarno's approach, but also a few other tips and tricks that I learned through my own painful experience. Check out the links in the description. I think you're going to find my free book to be really helpful. I also have a great course on healing back pain. You can go for 30 or even 90 days, and you're going to once and for all completely address back pain in a very detailed step-by-step way. And by the way, the next video that's going to appear above me goes into more detail on how precisely to address chronic back pain completely, both by using Sarno's approach and addressing the physical part as well. I will see you there, and until next time, be brave.